Well, hello and welcome to the COVID-19 Wellness Series. My name is Jake Dheer. These series are put together by Serve Canada in association with ARRA Arts, two great organizations doing great work locally here in Canada, but also internationally. This particular series is really supporting Trillium Health Partners and and the great and really supporting us because during this crazy, unprecedented time of COVID-19, it is so important that we take care of our health physically and mentally, and we take care of each other. So, Anu Srivastava, who's the founder of ARRA Arts, came up with this initiative of putting this COVID-19 Wellness Series together. Today, we have a very, very special guest with us, and I'm going to invite Anu to talk a little bit about the series, the initiative, and then introduce our very special guest from Trillium. Anu, over to you.
Well, welcome everyone to the COVID-19 Wellness Series. At the foremost, I'd like to bring the greetings from our local MPP, Nina Tangri, and who has supported our initiative and endorsed it. So thank you so much, Nina, for doing that.
Hello, I'm Nina Tangri, your Member of Provincial Parliament in Mississauga-Streetsville. On behalf of the Province of Ontario, I would like to recognise Serve Canada and ARRA Arts for hosting the COVID-19 Wellness Series of Workshops in collaboration with the Trillium Health Partners. The COVID-19 pandemic has impacted so many of us with feelings of anxiety, depression and uncertainty, but it is important to know that help in various forms is available for all of us in our community. The 10 virtual workshops by Serve Canada and ARRA Arts talk about how to care for our mental health or wellness and other common health issues during the pandemic. We are thankful to Mississauga residents like Anu Srivastava who have taken the initiative to help our vulnerable populations through the COVID-19 Wellness Series. I would like to thank all of you for physically distancing and doing your part to combat COVID-19 and ask that you continue to please stay safe.
Mayor Bonnie Crombie here from the great city of Mississauga, sending my best wishes to all the organizers and participants attending the COVID-19 Wellness Series hosted by Serve Canada and ARRA Arts in collaboration with Trillium Health Partners. COVID-19 pandemic has brought so many uncertainties to our lives and has disrupted our way of living. It's okay to not feel okay during these uncertain times. It's important to stay active and stay connected mentally, physically, emotionally, and spiritually. The COVID-19 Wellness Series is an opportunity for people to distress and take care of their mental health and well-being. By showing up at today's session, you are making your mental health a priority, and you should be very proud of yourself. Brighter days are ahead. In the meantime, stay healthy and stay safe.
Well, welcome everyone to the COVID-19 Wellness Series. About 8 months ago, when the pandemic started, everyone was with the thought that this was going to last for a few weeks. But here we are, 8 months later, and we're still struggling. So at some point in June, Serve Canada, which is a health and wellness organization, and ARRA Arts, which is a social wellness organization, they came together, and the thought was that we should come up with a series or something that would really help our community overcome these challenges which we are facing because of the COVID coronavirus. So when virtual workshops were thought of that institute and range from a variety of different disciplines, we were thinking that we would have the medical professionals and basically look at ourselves and take care of ourselves during this difficult period. So we came up with the idea of the COVID-19 Wellness Series. And today, I'm really privileged to get a guest from Trillium Health Partners, who is a registered social worker, and she is a psychotherapist as well. and she works in Mississauga Hospital. And I would like to welcome Miss Ruby Shah.
Thank you, Anu. It is my pleasure to be here and to be a part of this wellness series. Thank you.
Ruby, I'll start with the first question. What is the role of social worker?
Well, the role of the social worker, especially on a mental health unit, it's a very critical role in the sense that the social worker participates in the wellness of the patient's health right from the beginning to the time that they're discharged. And when the social worker works with the patient, it's in terms of conducting a psychosocial assessment. Social workers are also involved to a certain level in treatment during their stay at the hospital, as well as the discharge planning, which is also a big part of providing support for the patient. One of the things that's very important is that social workers work from a system, meaning when they conduct the psychosocial assessment, it's from a perspective of how the systems or the various systems in the patient impacts their health. That is their family, school, work, and then what's happening in the community at large. Take, for example, COVID-19.
So can I just ask a question on what exactly is psychosocial assessment and what is really covered under that?
Sure. A psychosocial assessment is an assessment where it allows the social workers to get a better understanding of what is going on with the patient. That is really understanding the patient's story. So this involves being able to, first of all, get an idea of what happened, what caused the patient to be admitted to the hospital at this point in time. Are they working? Are there issues regarding finances? Is there impact made by the family? What is the relationship with the family like? Do they have housing? Has certain aspects in life happened, such as there might be court hearings, or there might be abuse, or some kind of, CAS involvement. So there's a number of things that are involved in getting information on that helps to understand the patient. And then, of course, then also we rely on getting information from the family members as well, because initially when patients come in, they're quite sick and they can't always engage in conversation. So we rely on the family to get collateral. And also we look at, of course, review past clinical notes, so we know what the patient has gone through in the past. And, that gives us feedback in terms of what worked in the past and what we need to work towards in helping them now.
That was very nicely put and very simply to understand like what all it entails, and it kind of touches on each and every aspect of your life. How do you consider this as a holistic approach?
Well, it's holistic because, we're looking at the person as a whole. That is, we want to be able to look at how everything or all the things that are impacting the patient. So when we think about mental health, first of all, it's a multifaceted issue in the sense that it's a illness that has come to be for a number of reasons. Patients, when they're in the community, there's a lot of things that can happen. And for example, I would say, the social determinants of health. Do they have a job? Does it pay well enough? Do they family problems? What is their education? What are other things in their environment that have impacted them and has triggered this mental health issue? So in the same, way, the solution or the treatment approach to mental health is holistic. There's a number of things that have to be addressed in order to support the patient and for the patient to have sustainable recovery when they're discharged from the hospital.
One thing, Ruby, so are you in the inpatient mental health unit? I'm sorry, I did not ask you that before.
Yes, I am. So I am on the inpatient mental health unit. So essentially, when patients come to the hospital, they come through the ER where initial assessment is done by a crisis worker. And then the patients they move to one of the three different units that we have at Mississauga Hospital. We have an intensive care unit where the most critically ill go there first. And once they have attained a certain level of improvement through medications, then they're put out onto the open units, and there's 2 open units, and that's where additional treatment is addressed.
For those of you who are just joining us right now, we're speaking with Ruby Shah. She's a registered social worker at the Mississauga Hospital Trillium Health Partners. Ruby has more than 20 years of clinical work experience in mental health, and she provides psychotherapy using different modalities. She's also a designated capacity assessor under the Ontario Substitute Decisions Act and 1992, authorized to perform assessments of mental capacity for personal care and financial decision making. Ruby, it's such a great honor, and thank you so much for spending some time with us and engaging and informing the folks that are engaged with this episode. The whole world's changed during COVID-19. The norm that was is not the norm, and there is a new norm. How is the role of the social worker changed? I assume it's probably more challenging now during COVID-19 than it was under normal conditions. Give us your thoughts on that.
Sure. Jake, one of the things that I guess how COVID-19 has impacted all of us, it's actually in the same way that has impacted us in the hospital setting. That is, as service providers, we still maintain social distancing. Organizations, facilities, hospitals, we're all practicing social distancing. However, we still want to be able to provide compassionate and that human factor of being able to connect with our patients. So in those terms, it is challenging because we're not able to communicate with them in the same way that we did in the past. However, we are still trying to be able to provide as much care as we can, and we rely on different technology means. So video conferencing, online telephone calls, all this is via technology, really, because we can't have the same sort of in-person family meetings and assessments that we used to do before. So that is definitely one challenge. The other area of challenge is, in terms of the resources that are out there in the community, they've dwindled in the sense that there isn't the same level of resources available because they themselves, our community partners, are also, social distancing to some extent. Some of the community partners are working from home or they've decreased their hours. So the number of services that were available or to the level that they were available has also changed.
Wow. And let me ask you this then. How is the mental health team adjusting and providing care?
So the mental health team is trying to be also mindful that we want to be able to be available for the patients in that same compassionate and solid way that we have been in the past. So again, we are relying on technology. So we are sort of focusing more on video conferencing, telephone call meetings with the family. Now the doors have opened up a little bit, so some family members can have certain amount of time to come and visit their loved one on the unit. However, we try to keep that mostly for the family, and we try to do the family meetings again through the video conferencing, because we don't want to really take that time away from the patients, because we would like for them to spend whatever time they can get is to be with the family.
Ruby, we are indeed in unprecedented times, and the global crisis is immense. And honestly, we cannot thank you guys enough, our frontline heroes, all of you who are working so hard, looking after us and our people and our communities. So, thank you, first of all, for that. But during these unprecedented times, how are you guys taking care of yourselves and your teams? That would be so challenging at this point of time.
Anu, you're right. It is definitely challenging for the service providers. But, we try to acknowledge the fact that it is a challenging time and we're not able to provide the best, I guess, way of care that we worked to in the past, and we acknowledge that. And then I guess we also kind of, realize that, it's not a perfect way, but we remain solid in that we do the best that we can at this time. And of course, like in any areas in the community where there is service, whether it's in a restaurant or in other areas in the community, try to, I guess, engage in self-care, just as all of us should, to engage in self-care. So we take some time off, we have discussions, check-in times with our fellow workers, we communicate this with our managers in areas that we find that are challenging, and then we kind of brainstorm together how we can provide, the level of care that we would like, but in a different way. And then, of course, spending time with family, we always have to schedule that kind of time, whether it's with physical fitness or social to some extent, of course, being responsible to be able to really still have that in our life, because we want to normalize our life to the best that we can.
So, I know it's going to be very, very difficult for all of us, and we all are trying our best. But if there was one piece of advice that you would really want to give our community at large, because the point of this series is something that can be a takeaway for them in simple and relative terms, people who are trying to adjust to the new normals, what kind of advice would you give them?
Okay. When I think about all those in the community, I would really say to them that this is a very difficult new time for all of us. We're all in it together. We're moving forward slowly but surely. Whatever level of anxiety or whatever level of stress and agitation that we're feeling, keep in mind that we all feel this okay to feel this way. So it's really important for everyone in the community to know that this is something we're all going through together, and we're definitely moving forward in a positive direction as we're starting to see light at the end of the tunnel, that we are resilient and we're strong and we will get through this. And for community members, for them to be able to engage in good coping strategies, being able to, reframe themselves by not connecting with media all of the time. Of course, we need to connect with media to be able to get direction in terms of how we should be engaged in various activities in the community. But other than that, we need to be able to keep that in balance. If we continue to watch, say, for example, CP24 or CNN, as we can often get addicted to that, we need to be able to just take media into, I guess, our perspective of balance. And then we need to focus on other things, the normal things in life, such as being able to engage in physical fitness, having a good sleep hygiene. That's really important, getting enough sleep. Being able to, responsibly communicate with our family members or friends in a way that we're not, I guess, putting ourselves at harm or increasing the level of risk for others. So there's a lot of normal things that we can do, but sometimes we lose, I guess, perspective on that. It's very easy for everyone to focus on the negatives and then discount the positives. So that is something that I would definitely recommend to people in the community. Let's focus on the positive, as there are many positives in our life, and those challenges that we're dealing with right now, that we will get through them. And just hope is a very important part of a coping strategy in not losing sight of that. And we are moving forward. Sometimes you have to go through a difficult, sort of a muddy time before you can start seeing the progress that's being made.
Thank you.
So true. True. You've raised some very good points and made some great suggestions. The word resilient has been used so much during the past few months, and it speaks to who we are as Canadians, but really speaks to who we are around the world, because and especially our healthcare workers, our healthcare professionals. And thank you, Ruby, for all that. Stress is very high, and you talked about the media. Now, I'm in media, so I will never say not to be tuned into media. And I don't think you said that either. You said you need to have that good mix. You need to, and it's very important, because during this time you need to be informed, but make the right decisions. Make sure you spend time, and as you said, think of hope. Think about all the positive things that are happening in your life and around you. Otherwise, you could really get drained. Let me ask you, are there any other strategies to cope with during this unprecedented time?
Yes, actually, there's quite a few. So when we think about strategies of coping, it's not necessarily coping with just even this particular challenge that we're dealing with in a global way, COVID-19, but even in other areas where we feel stress and anxiety. It could be a work related, it could be a relationship related, many other ways. So we need to be able to use certain, what can I say, from a therapy perspective, cognitive behavior therapy is huge in terms of really changing your mindset. By changing those thoughts that we have at that point in time, which are negative, we can reframe them. We can always make that thought a little bit better. That's not as terrible or as potent or horrible that sometimes we frame it. So changing the framework of how we think is a huge benefit, and it's a great coping strategy. We can also, what can I say, to focus on gratitude. And when I mentioned earlier about good things in our life, if we can be mindful, see, mindfulness is also another coping strategy, of being in the moment and focusing on the good that's in our life, that takes a long way. And of course, we can also, activities of physical fitness, listening to music, having great conversations, and really filling our life with good, meaning positive thoughts. That in itself can be such a great comfort. And there's no benefit in just worrying, and sometimes, but over worrying, you are really ignoring the good that's there. So I guess if we can be mindful about and practicing gratitude of the good things in our life, we can come out doing very well.
Ruby, and Anu will wrap it up. But I really, I had to step in what you just said. Being mindful and showing gratitude. Too often we're busy thinking about ourselves, and this is the time. And we just celebrate Diwali, and this is really the time of giving thanks and really being, being self-reflective, and never more has there been a time for us to reflect, to be mindful, and really to show gratitude and to say thank you, whether it's the grocery store clerk, whether it's the Uber driver, whether it's our healthcare workers, whoever it is time to show gratitude. And I want to show gratitude to you for being a part of today. I'm going to have Anu wrap it up, but thank you again for being a part of today's conversation. Very engaging, very informative during this time, especially.
Thank you. My pleasure.
Thank you, Jake. And what a delightful conversation it has been. And there's so much of insight into everything that you spoke about, Ruby. And the universality of the situation, that each and every one of us are in the same boat. That is such a huge consolation. And everything else that you talked about, whether it was hope, whether it was positivity, whether it was gratitude, I think it is so important for each one of us to reflect at this time. And thank you so much for being part of the series. And I would really appreciate you and everyone in Dr. Dawes' team. Thank you.
Thank you
And
so
I'd
much for
like to
having me.
now thank Jake Dheer, who is our moderator, who is very, very active in the community, and he is in the board of the Trillium Health Partners Foundation. Thank you so much, Jake. This series would not have been possible without you being part of this. So thank you so much. I do appreciate all the time and effort that you've made to be part of this. And I would also like to thank our technical producers, the Y Media team, Yudhvir Jaswal, Preet Jaswal, Gurpreet ji, Anga ji, the whole team. All this series would not have been possible with the help and the support of everybody, each and every one of you. And thank you so much. And Jake, I'll leave it to you to wrap it up.
Thanks very much, Anu, and thank you really to you as the founder of ARRA Arts and the visionary behind this initiative. You've put together some amazing guests that have provided incredible information, especially during this time of COVID. So thank you to you for the initiative. Thank you to Serve Canada in association with ARRA Arts for putting this together in support of Trillium Health Partners. Folks, if you have an opportunity, if you're able to donate to Trillium Health Partners Foundation, there are three hospitals. There's the Credit Valley Hospital, the Mississauga Hospital, and then the Etobicoke site, the Queensway site. If you're able to donate, it's right at the bottom of your screen. Please log on and be generous, donate whatever you can. This is a very simple time, and we can show support for healthcare workers. That would be great. Again, thank you very much for being a part of today's conversation. We hope you found it informative. We'll continue to share more and more with you as time goes on. Again, have yourself a wonderful, wonderful day. Be safe, take good care, be well,